This podcast is sponsored and brought to you by HealthShare Integrated Solutions.
The day started like any other, but it ended as one of the most harrowing experiences of my life. It was a quiet Tuesday morning when I felt an unbearable wave of dizziness and weakness. My vision blurred, and my breath came in short, panicked bursts. My family rushed me to one of the well-known private hospitals in Port Harcourt, hoping for swift medical intervention. Little did we know, the chaos that awaited us would bring me dangerously close to death. Upon arrival, the nurses quickly triaged me and directed me to the emergency ward. A doctor on duty examined me and ordered a series of urgent tests: blood work, urinalysis, and an ECG. "We'll stabilize you once we get the test results," the doctor assured me. His calm demeanor offered some comfort, but it was fleeting. As time dragged on, my condition worsened. My lips turned pale, and my strength ebbed away. My family repeatedly inquired about the test results, but each time they were met with vague responses and promises that the lab is working on it. Hours passed with no actionable information. Finally, my brother demanded to speak with the laboratory manager. After some back and forth, a frazzled-looking man emerged, clutching a folder. "We've had the results for over an hour," he said, almost casually. Shock rippled through the room. "Why haven't the doctors been informed?" my brother asked, his voice trembling with anger. The lab manager's response was maddening. "I assumed someone would come for them," he said, shrugging. Apparently, there was no established protocol for relaying critical test results to the attending physicians. This lack of communication could have cost me my life. The results revealed I had dangerously low hemoglobin levels and severe electrolyte imbalance. The doctor, visibly alarmed, ordered an immediate blood transfusion and intravenous fluids. Within minutes, I was being prepped for the procedures that would ultimately save my life. As I lay on the hospital bed, I couldn't help but think about how avoidable this ordeal was. A simple phone call, or a more coordinated system between the lab and the doctors, could have spared me hours of agony and the risk of dying. Reflecting on the experience now, I'm grateful to be alive, but I'm also deeply troubled. This wasn't just an issue of negligence, it was a systemic failure. Lack of teamwork and poor communication between critical departments in healthcare can have fatal consequences. My case is proof of that. Today, I share this story not just as a cautionary tale, but as a call to action. Healthcare providers must prioritize collaboration and efficient communication. Lives depend on it, mine almost did.